John. I'm a medical student here at the
Morning.
clinic. Brandon, nice to meet you.
Yeah.
So what brings you into the clinic today?
I need to get my meds refilled.
Okay.
Yeah.
Have you ever been seen at this clinic before?
Here? No, I just moved here.
Okay.
Came from Asheville. Long story, but I'm here.
As you know, anytime you establish care at a new doctor's office, we have a lot of questions that we like to ask, get to know more about you, more about your medical history and everything.
All that
So we're
fun
just, going to go through that process today.
Okay, let's do it.
All right. So first off, can you just tell me, do you have any past medical concerns?
Concerns? Not personally. My doctor says there's some concerns, but it's no big deal.
Okay. Can you tell me a little bit more about those concerns that your doctor had? And
Yeah, he just puts me. He has me on all the kinds of medication. I only want really a couple of them, but here's a whole list right there.
Okay.
That's what I take.
All right. Adderall,
Yes.
Ambien.
Yeah, that helps me sleep.
Okay. Lisinopril.
I have no idea what that is, but they tell me I have to take it.
Okay.
Mm-hmm.
Hydrochlorothiazide.
Something. Yeah.
Okay. Flexeril.
Yeah, that's good. That helps my muscles relax.
That helps your muscles relax. Okay. And Vistaril.
No idea why they gave it to me.
No idea.
Mhm.
And then you're also taking ibuprofen.
Yeah. I have headaches.
Okay. And then melatonin as well.
Helps me sleep too.
Okay. So that's the full list of everything you're taking.
Mm-hmm.
Anything over the counter?
No, not really.
Okay. So now, need to just go a little bit more in depth about each of these medications.
Okay.
So the Adderall, you're taking, you said, for ADHD?
Yes, every day.
Okay. And do you know when you were diagnosed or how long you've had ADHD for?
I think they diagnosed me when I was like 5 or 6. Yeah.
Okay.
Yeah.
And you've been on Adderall ever
On
since
it.
then?
Yes.
Okay. And do you have the records from your past doctor, or is this everything that you have?
I don't have it. No. I just have my old script, like an old empty bottle. Does that count?
Yeah, I mean, that would be good just to be able to see that, like what your dosage was and everything.
Yeah,
that
it's
you're
30
taking.
milligrams.
30 milligrams.
Instant release.
All right.
Mm-hmm.
Thank you very much.
No problem.
And then, so other medications, your Ambien, how long have you been taking that for?
Not that long. Sometimes I got a hard time sleeping, so I don't take it all the time. But
Okay.
a couple years, maybe I don't know, a couple years.
Okay. And do you know exactly what you're taking besides for sleep? Was there anything that your doctor told you that you're taking it for? Is it anxiety?
Maybe. I don't know. They tell me all these things all the time. I don't know. I just
Okay.
what they gave it to me, I take it. That's it.
All right. And how do you feel like on a day when you don't take the Ambien? Do you feel nervous, anxious, that like you
yeah,
need that
kind
Ambien to
of.
help calm you down? help
Sometimes I don't take Ambien because then I hear that I do stuff in the middle of the night. So I don't want to Sometimes I don't take it. If there's other people around.
Okay.
Yeah.
All right. So you're taking Ambien a couple times a week.
Sometimes, yeah. Yeah, that's good. Yeah, a couple times a week maybe.
Okay. And that helps you sleep at night.
It knocks me out.
All right.
Yeah.
Has anybody ever talked to you about any other medications like the melatonin to help you sleep?
They have, but I've always taken that. It's always just kind of. Plus, it helps you dream better.
Okay. All right. How about, so we'll come back to the lisinopril and hydrochlorothiazide. Do you know what you're taking the Flexeril for?
My muscles get really tight, so
Okay.
it helps me kind of relax at the end of the day.
Did you have any previous injuries or accidents?
Yeah, I had a shoulder accident a long time ago. I was in a car accident, so
Okay.
it's fine. But it's fine now. But it just helps, when
When-
you're stressed.
When was that accident?
I was 12, so it was a long time ago.
Okay.
Yeah, I'm 31 now.
Got it. And so only the shoulder injury from the accident though?
But yeah, I think so.
Okay.
Maybe it was all over. I was in the hospital for a week. It's no big deal. But that's pretty much what it was. So.
Okay. And then how about the Vistaril? How long have you been taking that for, do you know?
A while, but I have no idea what it does.
Okay. And what does it do for you? Like what effects does it
It doesn't
have
make
on
me
you?
feel any better, any worse, I don't think.
Okay.
There's no euphoria, so it's not really good.
Okay.
Yeah.
So you're taking it for, you don't know why, and it doesn't really...
My mother did all this. She took me
Okay.
and I started taking them. I don't know. I just take the medication and I go home.
Okay. So probably something we can talk about as we move throughout this session is
Okay.
what medications you need and don't need. And if that one's not really giving you any benefit or relief, it
Well,
might
what
be-
does it supposed to do? Let's talk about that.
So it's pain medication that can help, but
It's not an opiate, though, is it?
no, it's not.
Yeah, that's why I don't care.
Not an opiate. So we'll talk a little bit more at the end of the session about what meds you need to be on and don't need to be on. But want to make sure that we get through everything
Okay.
and don't get
No big deal.
too far sidetracked, okay?
Okay.
So, do you know what you're taking the ibuprofen for?
I get headaches.
Okay, so
Yeah.
you take them,
Yeah.
do you take it every day? A couple
Yeah, I
times
take
a day?
800
or-
milligrams because I have the prescription, the big ones.
You take the ibuprofen every once in a while
Mhm.
for headaches, and then you take the melatonin. Do you take that every night?
Yes.
Okay.
Yes.
And when you take it on nights that you don't take the Ambien, does it help you fall asleep?
No, I need all of them together.
Okay.
Yeah. Because I think I'm so used to taking all of them that if I don't have it, like, it just... Am I going to be able to get my Adderall today?
So, I'm the medical student on the team. I can't tell you officially that you're gonna to get the Adderall or not. I'll talk with the attending doctor. They'll come in and meet you today.
Okay.
But should be able to get you your medication.
But I'll see her today? Okay.
Yes.
I just want to make sure.
Okay.
That's important. It's important.
Yes.
It's very important.
Most definitely.
Yeah.
And she'll be in after we just finish gathering a little bit more history
Is
about
she
you.
pretty easy to get those from?
Is she easy to get
Yeah.
those medications from?
Yeah.
Well, she wants to make sure that you appropriately need the medication. You're taking it as prescribed so that you're getting the benefits that you need.
Okay.
Okay?
Okay, thank you.
You're welcome. So, a little bit more about your medical history.
Okay.
So, have you had any surgeries in your past?
I had a tooth pulled. Does that count?
That is a surgery, yes.
Yeah.
All right. And then, besides, we talked about the ADHD,
Mm-hmm.
and you're taking all these other medications, but you don't know of any like chronic diseases like diabetes.
No, I don't have cancer or anything.
No
No
cancers.
cancer, no
Okay.
diabetes.
All right. And then,
Oh, I have Hep C. I forgot to tell you that.
okay, so you have hepatitis
Yeah,
C.
yeah.
When were you diagnosed with that?
5 years ago.
5 years ago.
Yeah.
Okay. And diagnosed by your primary care physician?
I was actually
or
a physician at the psych ward.
at the psych ward.
Yeah, no big deal. It's fine. I'm totally fine.
Okay.
Put that out there. But
Would you mind telling me a little bit more about when you're?
I got. See, people, when I say that, people think I'm crazy. I'm not crazy. I was literally just out and about, and I got a little too drunk, and then I went a little belligerent. So
Okay.
they just kept me for a little bit. No big deal. It's like a little vacation.
A little vacation. How long were you?
3 days.
there? 3 days.
Yeah.
Okay.
I
And
hold you more than 3 days.
so, were you in a psych ward or?
Oh, it was a psych ward.
Okay.
I
so
couldn't
you,
leave.
You weren't in jail
No.
or in holding.
Wow. Okay, I'm not a criminal. Okay, I just had a little issue. No, it was a psych ward. It was a hospital.
Okay.
Yeah.
And at that time, did they tell you anything? So you said you were drinking, got a little crazy the night
Drinking, doing some other stuff.
before. Okay.
I hadn't slept for a couple of days. Don't tell the doctor that,
Okay.
because then she won't give me that to me.
So you hadn't slept for a couple
Yeah.
days, and were you taking any other non-prescribed medications at the time?
Define not prescribed.
So any like marijuana, cocaine, heroin, anything like that?
I mean, it's not technically legal, but I think it's been used for a long time. They call it meth.
Okay.
Asheville.
Yeah. Okay. So you
That's because I was out of Adderall. So
you're
it's the
on
only
your
reason I took
Adderall,
it.
so you started taking meth,
That's the only reason.
and then you had this 3-day where you weren't really sleeping,
Yeah.
and then
Yeah.
were you mixing other like alcohol, other medications in there as well?
Could have been.
Okay.
Yeah.
And then after that, so you were locked up for 3 days
In the psych ward.
in the psych ward,
Yeah.
and then after that, do you still use meth when you
No.
don't have your Adderall?
No. I'm a law-abiding citizen nowadays.
Okay, so that was in your
My
past.
past, my previous life.
Okay, and so so you used meth in the past. Sorry, I'm just make sure I get the story straight. When was the last time that you did meth?
A while ago.
A while ago. No other illegal drug use. No heroin. No cocaine. Nothing. Like that?
Not recently.
Not recently.
That's all in the past.
Okay.
I don't know why doctors always want to talk about stuff that happened in the past.
Well,
I'm here now.
there's always concerns just with illegal substances, meth, heroin, cocaine that would mix with medications that you'd be on.
Oh yeah.
So we don't want any negative side effects there.
Yeah.
But also, so we started this conversation because you had mentioned that at that time you found out you had Hep C.
I did. Yes, I do have that. Yes.
Okay.
Yes.
And have you sought out treatment for the hepatitis C?
I did, but then my insurance denied it, so like it's like a whole big thing in the deal. So
Okay.
I'm fine.
All right.
Nothing's gonna happen for like 20 years. I'll be good.
Okay, so I would advise you, and the physician that will come in will talk to you more. So there are more and more treatment options that are becoming available for hepatitis C. Again, as you already noticed, like some insurance plans don't cover it. So we can see if we can work with you today.
Yeah,
what your
absolutely.
insurance is to see if we can get you coverage.
Yeah.
While it might not seem like an immediate risk, something that happens way along down the line, if you can treat it and prevent any of those complications, that's a fantastic thing to do for your health. Okay? But again, you can talk with her more about that
Yes, I'll talk
after she
to her.
comes back in, or comes in. Okay, so got a lot of medications that we know about, and no past medical history besides ADHD and some high blood pressure that you're taking medications for, but don't really know too much about. Why do you have high blood pressure? I'm not exactly sure. There are a lot of different causes for high blood pressure. It can be based on our exercise and our eating habits. There can be some genetic components that can cause people to just have naturally higher blood pressures.
Okay.
So I don't know, I can't speak to exactly why you have high blood pressure. But just seeing that you're on a couple medications for your blood pressure makes me think that you had something wrong in the past. But do you take those medications regularly? The hydrochlorothiazide and lisinopril?
I mean, it's not my first prescription. If I have money, it's not my first prescription I go and get. I mean, it's not exactly top of my list.
Okay. Can
you guess which one it is?
Yes, based on our conversation, I know you're here, you really want your Adderall filled, and that's totally understandable. But how often would you say you're able to fill your medication? Are you having difficulties every month?
I think
getting
I still
them, or-
have like a few refills at the pharmacy. So I don't know. I haven't even got it for a while. Actually, now that I think about it.
Okay, so that's something else that we can work on. There are different prices at different pharmacies, and our pharmacy in-house here, you can normally get your medication.
Oh, there's a pharmacy here?
And so,
It's the best.
we can work with you,
Okay.
find out what's affordable and what you're able to pay for.
Okay. On it.